My greetings to everyone present here. Dr. Mansukh Mandavia ji, Honorable Union Minister of Health, Family Welfare, Chemicals and Fertilizers, Government of India. Let me, friends, indicate to you the name Mansukh. Those who are not familiar with Hindi, it is sublime happiness. And there can be no sublime happiness unless you are healthy. The right man in the right seat, accomplishing the right objectives. In his discourse, apart from other things, he reflected India's age-old wisdom, our ethos, our civilizational essence, that we don't treat health as commerce. Engaging in health sector is an opportunity to serve the humanity, but not to engage in commercial exploitation. He has rightly indicated it is service. And the underlying object is service limited, not to your family, not to your country, but to the entire world. In our country, historically we have taken the world to be one village. And that, friends, is also the motto of G20, of which India presently is heading here. Sri Sunil Kumar Gupta, Secretary, Vice President of India. Dr. Rajiv Bahel, Secretary. He is also Director General, Indian Council of Medical Research. I heard him with rapt attention. How seamlessly he unfolded the strategy that is in action. And I can assure you, friends, this is the ground reality in the country. I'll come to it a little later. Professor V.K. Paul, Niti Aayog member. I don't have to say, he brings on the table innovative approach, how to tackle situations, how to motivate the sector, how to inspire it, and how to ensure that we get the best that can be available for health sector. Excellencies, our foreign delegates, various stakeholders, WHO representative to India, Dr. Roderico Offrin, and everyone present here. I would at the outset commend the organizers of this conference and how, if I go by the document given to me, 3 organs, Center, CCD has come together with the government, with WHO, World Health Organization. When I went through the sessions, I was really surprised. No one can improve on the agenda that has been set for deliberation and discussion. And it has been done in such a rational, methodical manner to bring about an ecosystem that will generate wellness of humanity. Session 1, friends, affordability of healthcare services, a very critical aspect. Keeping in view this affordability, our Prime Minister Narendra Modi ji came out with Ayushman Bharat. And that is the spinal impact adversely to a family, to friends, if you are taken ill or suffer from a deadly disease, that has to be contained. The world's largest, most transparent, accountable, impactful mechanism is benefiting 1.4 billion people in this country effectively. And this affordability, friends, has generated into evolution of a system that is not pyramidal. Pyramidal means there are some people who can afford. They can afford the best. It's not available everywhere. But the concept that the Honorable Minister has executed very successfully is a plateau kind of a development. Because of this Ayushman Bharat, we have in the country paramedical forces, we have diagnostic centers, we have growth of medical colleges, we have growth of nursing colleges, we have growth of clinics, and that has brought about a plateau kind of a development. So affordability. And this touches the lives of those who are fiscally vulnerable. If they have to suffer on the count of affordability, then growth of their children is impeded. The family's economy goes haywire. There is a great focus on affordability. I'm sure the deliberations will give new dimension to it. When we come to second session, availability of healthcare technologies. Friends, technology is a game changer. Technology is a turning point. And if it is not available, then we have to go to various places. Let me give you a small illustration. In 1989, I became Member of Parliament. I was a Union Minister. 2 years before that, my father was taken ill. He suffered heart attack. I had a tough time first in trying to secure angiogram. It was available selectively only in 2 cities. And I had to take him for treatment outside the country in the UK. Now, all this is available in this country at division level. Not in the state capital, at divisional level. And of the highest quality. So this availability is a game changer towards good health and happiness. Friends, we may afford, it may be available. But the third important subject on which you all will be deliberating is accessibility. I reflected on it a while ago. So accessibility to healthcare technologies. We have wellness centers, not in tier 2 cities, not in semi-urban areas, but even in the villages. And that is a milestone achievement, a significant development. And the fourth session, which will be taking care of all these together through HTA, and that is way forward stance, with collaborative efforts to enhance these segments. Now, what is more important? Any institution, the safest way to degenerate is to keep it away from accountability, keep it away from scrutiny, keep it away from assessment. In a sense, don't audit it. This International Symposium on Health Technology is assessment-oriented. You will be critically assessing these situations. And that, I am sure, will go a long way in securing a world order of health and happiness. Let me share certain experiences with you, friends. When our Honorable Prime Minister assumed office in 2014, that was after a gap of 3 decades that the country came to have a single-party government. In 89-91, I was part of a government that was coalition of 24 parties. 2014, we had a single-party governance. And he, following the footsteps of father of the nation, Mahatma Gandhi, one fine day he went to a place and started a campaign, 2nd October, the birth anniversary of father of the nation, Swachh Bharat Abhiyan. Some people thought, what is he doing? Prime Minister of the largest democracy, mother of democracy, has taken to cleaning. And friends, this has changed the landscape of Bharat. Consequently, what we never thought or imagined, every household is having a toilet. What we never thought or imagined, we are on way to getting fresh potable water at home. And side effects are such that there has been industrial growth, startups, entrepreneurship has grown. This is generating mass movement for securing health and happiness of the people at large. I was Governor State of West Bengal, and that was the time the world was visited with pandemic, non-discriminatory, adversely impacted all, high and mighty, rich and poor, countries, irrespective of geographical location. It impacted. India's handling of COVID exemplifies the best practices beyond doubt now. I remember the day when, as governor, it was flashed to me that the Honorable Prime Minister of the country has called for people's curfew. Curfew is normally taken to be by legal regime, by state actor. But to combat COVID, to inspire and motivate people, the leader of the largest democracy gave a call, people's curfew. And then people learned the art. You will have to maintain curfew so that what was advised to contain COVID could be translated into action. It was done very successfully. It was equally enlightening to me when we got a flashed news that the Honorable Prime Minister will be there to cheer the COVID warriors. And what we do traditionally, we will take and ghanti bajayenge. We did it. Because COVID warriors were those who were prepared to lay down their lives to save the lives of people at large. And we were quick in the country to come out with a legislation so that full protection is afforded to them. Third, we lighted lamps to honor them. With his vision, he advocated hand-holding. It doesn't matter you give succor to whom. Number doesn't matter. Your intent matters. One who could feed 100,000 people was as good as one who could feed 100 people. That is something I have seen myself in that position. In that perspective, when I have gone abroad on 2 visits, how satisfying for me it was to note that when India was facing COVID, India could innovatively have vaccines. India could vaccinate 220 crore people and put it on digital mapping. It was also giving assistance to other countries, vaccine mastery. And that is something reflective of our age-old ethos. Pehla sukh, nirogi kaya. The first concept of happiness is we must be healthy. Friends, I do not wish to take more because much has been said. But what I have seen, 1.5 lakh health and wellness centers, they have come up in the country. They are functional. And the technological upgradation is taking place. This is generating huge opportunities for entrepreneurs, for skilled human force. It's turning out to be a great game changer for economic growth also. Over 33.8 crore Ayushman Bharat health accounts. And there are 50 crore beneficiaries of Pradhan Mantri Jan Arogya Yojana. Now these numbers to the world at large may be staggering. But in our country, the development is proportionally manageable. It is being done in a very structured manner, not in isolated instances or otherwise. Affordability of medicine to the ordinary man is of critical consequence. This has been done in a very organized, well spread out geographically. Centers, 9,000 Jan Aushadhi Kendras. Friends, cancer is a deadly disease. And what has been done in that area is amazing. By providing of medicines that are affordable. On an estimate, 200 crore per annum is a saving to cancer patients by the proactive, affirmative steps taken by the Honorable Minister. And himself monitoring at micro level. Technology has been used. You don't have to physically negotiate in this country to secure assistance. India is an example in the world where we have used technology for making available efficient service to the people. There was a time when I was a student or even a member of parliament. There used to be long queues to deal with your payment of bills. There used to be physical transactions of money. No longer. But in the health sector, revolutionary thing has been done. And over 8 crore, 80 million teleconsultations have been conducted through e-Sanjeevani. The National Telemedicine Service of India. And friends, this is catching up at geometrical level. This is turning out to be two-way aspect. Because if you get the right consultation, if you get the right diagnostic report, treatment is easy. I have seen in my country, our Bharat, TB, tuberculosis, was a sure killer in 50s and 60s. But now, if you go to even a chemist shop, a patient says, I have TB. By robust common sense, well-known mechanism, the chemist shop may give you 9 months treatment. There's a qualitative jump in these things. Nothing can happen unless you focus on educational growth. We used to have tough competition for boys and girls to be admitted to MBBS, to postgraduate courses. I compliment the Honorable Minister for having imagined and executed. And the number of seats in graduate, postgraduate have been doubled. Friends, I don't wish to take more. All I'm saying is, if India is on the rise at the moment, as never before, and rise of this country is unstoppable, is going to be geometrical further. This is on two great concepts. And those two great concepts were highlighted by our visionary Prime Minister in last year and a half. One, he gave a message to the world. We are not in an era of expansion. Expansion by nature is invasive action. Expansion by nature is compromising somebody else's sovereignty. Historically, this country has never engaged in expansion. And second, he indicated to the world at large, setting a global discourse, which is catching up. War is no solution to any problem. And both these two things I have indicated play havoc if they visit us on our health, on our happiness. So I would urge everyone here present, all stakeholders, World Health Organization, and leaders, if we have to make this world healthy and happy, we have to subscribe to an ecosystem. And friends, in all modesty I can say, this country, Bharat, has evolved this ecosystem over thousands of years, and that is Vasudhaiva Kutumbakam. World is one family. Let us believe in that, and let us work to handhold each other to the best of our capacity to contribute to each other's good health, happiness, satisfaction. And in conclusion, I'll say, certain things are being created by us, like mental disorders, stressful working, tension all around in the workplace. We are in competitive mode throughout. I quite often tell people that I was throughout a gold medalist #1 in my class. I always suffered the tension and stress What will happen if I don't come at number 1? I share it with you all, friends. Nothing would have happened. I would have had a little more time to interact with people, make them happy, handhold them. So let us develop this mechanism. Let us disseminate, enlighten, and work so that we reduce the tension of the people. We bring down the stress level. We cut down what has come to be known in highly urbanized areas as lifestyle diseases. That lifestyle is not worth it. I am grateful for giving me this great opportunity, particularly to the Honorable Minister, whom I admire for a simple reason. He has out-of-the-box approach and solution to problems, and in a low-profile manner secures their execution and is never in a mode of reaction. Thank you so much.
Thank you, Honorable Vice President, sir, for enlightening us, for guiding us. We all